We continue our conversation tonight about the cost of diabetes on someone's pocketbook. Viewers reached out to us asking, is there any help with expenses? And so, Dr. Sandoval, let's talk about that. Is there help with expenses?
Aside from the cost of complications, one of the most expensive costs for patients who have diabetes are injectable medications such as insulin or the newest ones that are the GLP-1 agonists, right? Most of the medication for diabetes is pretty expensive, so in a patient that doesn't have insurance, that can add up fairly quickly.
So what can they do?
One of the things that we do for our patients is that different pharmacies across the valley will have $4 or $5 lists. And so asking the provider to work with you in identifying those medications, to try those first before you jump to the other more expensive medications is a good thing to do. Patient assistance programs, working with the clinic that you're seen at, if they have social workers or the medical assistants or the physician might find programs where you may qualify for them. Those would be the first two ways to go about trying to.
So asking questions and asking for help is really the best thing. Yes. Go to your doctor, ask for some help. So we discussed here, or you guys discussed here, this is a community effort. This is not about the person. This is not just the person that has diabetes. This is that person and their family and the community and everyone else that's touched by it. And it's not going to come to an end, or you're not going to get any better without the community's help. Dr. K, you want to talk about that?
I think it's important to understand your behaviors are shaped by your environment. If you have a lot of healthy food available in your neighborhood, or you go to schools where there's healthy meals served, or if you have access to exercise opportunities, safe roads, no pavements that are continuous, things like that, those are all very influential on your health. And that's where our public health infrastructure is a key stakeholder in terms of our community's health. So if you have poor quality schools, or if you have fast food restaurants that are more in number than grocery stores and farmers markets, you are setting yourself up for unhealthy nutrition that's going to impede diabetes outcomes.
And make sure there's education on the level of the children from the from elementary school up, that we introduce teaching them about these things, eating healthier, bring to the school the healthy meals, and build on that, because this is, I see it in the
So
county.
let's talk about what is the county doing?
I always say education's free. And so, while someone may not have the resources to implement a huge program, I think partnering up, like say UTRGV, say putting together municipalities, putting events together so that people can come out and get healthy, so that they can recognize that this is a start. You have to start somewhere. And I believe that you have to work with the children. Start with the children, but at the same time, you have to get the families involved. I think programs such as this, us being able to go out there and talking about it, openly talking about it, because she mentioned, Dr. Palacios mentioned the stigma. I think unless a woman got it from gestational diabetes, they're very hesitant to talk about it, because they do feel like, I did it to myself, and I'll look at the burden I'm going to place on my family, whether it's financial or time.
But this is we talked earlier, this is also, if you have a family history, there's a good chance that this could happen with you.
That's correct.
So this whole family being involved is so important.
One of the things is that we have to acknowledge a lot of the communities have done a lot of efforts. A lot of the cities have done a lot of different parks and recreation programs, a lot of walkways, bike trails. One of the biggest things, we could sit down and talk, Harry, about all the things that have happened in the past and all these terrible things, or the lack of funding or lack of things, but the reality is, talk about the future. And the future is wonderful. The greatest thing that happened to the Rio Grande Valley was UTRGV. Single-handedly, the university, the medical school, the interprofessional educational programs that are being developed now are developing the clinicians and the people, the public health officials, and the people that are going to guide our community to a healthier lifestyle.
So the viewers that are watching, you want them to know UTRGV's medical school is huge in our healthy future.
Our community has not grasped the importance of this medical school. For the next 5 generations, this medical school is going to alter the entire Rio Grande Valley to a better level, to a newer level. It's going to improve graduation rates, it's going to improve economic rates, because if a person is healthier, if a student's healthier, they graduate high school, they go to university, get the vocational training. But one of the most important things, it starts at home as well. The parents have to be the role model. Don't supersize those meals.
Don't do
Eat
that.
healthier.
Yeah, don't do that.
Cut out the soda.
Okay, well, we are definitely we're going to get the community involved, because we have doctors and nurses and pharmacists and lots of other health professionals that are all going to come together in just a few days. and there's a way that they're going to help our community. We're going to tell you what you can expect in just a couple of minutes. You're watching Channel 5's Together for Our Health Roundtable.